anterior posterior spread is increased. So the biomechanical value was improved. Cantilevering can be done than going for a sharp decolletage. So this is all the planning of your implant treatment matters here. This was recently done. Can you see a line drawn here? To tell the student this is where you needed to have the implant directed and maintain the same line. So they place. Can you see the triangulation? Yeah, exactly. Can you see the sinus one? No guide surgery here. It's again a free. It's not that I'm against the guide. நம்ம இங்கிலீஷ்ல வந்துட்டு இந்த கைடு யாருக்கு சொல்றாங்க போனார் கைடு இப்போ இந்த ப்ராஸ்தட்டிக்ஸ் வந்து நிறைய புக் வந்துருச்சுங்க ஒன்றும் பண்ண முடியாது பட் அவங்களுக்கு தான் இந்த குருடனுக்கு தொக்கு நடிச்சு போனாங்க அவங்களுக்கு தான் கைடு நாட் ஃபார் த பீப்புள் வித் சென்ஸ் அண்ட் ஐ. So we managed, coming to the complication. Okay, fine. Paresthesia, hematoma, suture abscess, implant intrusion to the sinus, cover screw exposure. Failures and complications of peri-implantitis, dehiscence, prosthetic failure, chipping of the facing ceramic, prosthetic screw fracture, framework fracture. Now, all these things are because of the improper design of processes. Now, this has happened here. A clinic where they tried to place an implant in a very thick cortical bone. Because of excessive force, the internal hex implant gave way and causing the fracture. Nothing can be done with these type of implants. We needed to retrieve. The retrieve panaka bayangara bone loss because we use a trifine bulb than the actual size of the implant. We just cut a block of bone out. So that is going to be difficult. I said sorry to the patient. I said I cannot. Patient always accepts if you say sorry and you tell them you don't manage that, worsening the situation more. Yes, intrusion to the sinus. Do not ever try placing the implant in the posterior region of the maxilla soon after the extraction. This is what happens. For the last 11 years, this ophthalmic surgeon is living with the implants. Nothing has happened so far. ஒரு வந்து கேட்டா என்ன ஆகும் தம்பி தும்முனா மூக்குலியா வந்து உங்களுக்கு கிளாஸஸ் எல்லாம் அப்படி விட்டு. Now, a lot of people are talking about the flapless surgical procedure. We always start with your drilling at the crest of the soft tissue, not at the crest of the bone. This is what happens. Wrong placement, exfoliation of the implant. Cover screw exposure because of the thickness of the soft tissue. Don't try to place the suture again. It will never get closed. Yes, the Ipanaraya Uripo, basal implant. These are the problems that you get. Dehiscence. Now, it's a beautiful, this patient had a canine missing. You can always do a preparation for the central, lateral, and the premolar. Or an endoscopic surgeon in Madurai, or a dentist. Place an implant in the canine region. The patient had a space infection. To remove the tooth, God only knows what implant it is. This is after cleaning. Now, connecting the implant to the natural tooth. Never ever do the connecting the natural tooth with the implant because periodontal ligaments got a viscoelastic property. It sinks and comes back. No, we do not have a parameters to say when it is going to come back. So it is just constantly with a hammer. So the prosthodontic component fails and the patient went for disintegration. Eventually we have to remove the implants. Now, again, wrong treatment planning. Starting from the central incisor, having an implant at the 8th region. Got fracture, we have to remove the screw. Can you all see the fractured screw? This is again the famous implant. The patient வந்து சார் பசையை வச்சு விட்டுடுவீங்க நான் உடனே என்னை பார்த்தா தீப்தி ஆஃபீஸில் வேலை பார்க்குறாரு பசையை வச்சு விட்டுருவேன் வேலை. So these are the patient, innocent patient, they all come to our clinic and they're trouble. இல்லை சார் அத்தனை லட்சம் நான் கொடுத்துருப்பேன் அதுக்கு நானே அடைச்சேன். So what is the remedy? I told him, remove all the implants, go for the conventional. But he was relentless. நம்ம சொல்றது பாதி பேர் புரியாது. Do not touch those patients. Do not ever touch those patients. Even if he's loaded with money, it's better to say, we are not meant for you. Don't tell they are not meant for us. They get offended. அது எங்க ஊருக்காரங்க ஜாஸ்தி. Fracture of the skull. This is my own case which you had saw earlier. This patient got a good amount of bruxism, very good amount of bruxism. So how you are going to manage this patient? Only have centric occlusion contact, no lateral occlusion contact. Give them a hard splint. Give them a hard splint. Now, fracture of the processing component. I told you about the anterior posterior split. Here the implants are kept in a linear fashion. When the domino effect in the cards are straight and if you make it zigzag, it will not, because there's a multiple fulcrum broken line. So it may not fracture. So follow the curvature of the arch and do not just place wherever that you get. So you need to follow the curvature of the arch for the biomechanical aspect. This is how it should be. Now, this is my first case because of the cantilevering. The entire process has got fractured, but we were in a position to repair that also. Of course, poor oral aging is another complication from the patient side. Criteria for success: clinically it should be asymptomatic, no mobility of implant observed, bone loss around the implant should be less than 1.5 millimeter after 1 year of body. The above criteria should be observed after 10 years in the load carrying implant. Only then the implant or implants that were placed in the patient's most success. Clinical follow-up. Can you see this case which I showed you earlier? After 5 years, after 10 years. This is after 5 years. 5 years, 10 years, 16 years. So, till 10 years the patient is shown a good osseointegration. I said goodbye to her. 16 years, whether she comes or she doesn't come, I am not bothered. I have crossed the limits of success. Conclusion: what should we focus on osseointegrated implant treatment? Establish good osseointegration, sustain osseointegration. With this, I conclude my boring, lengthy seminar. Thank you so much for listening. For stealing away your precious time of food and I'm terribly sorry for all this.